Hello everyone. So today I will be talking about my symptoms and the test that led to my diagnosis. I was recently diagnosed with non-sustained ventricular tachycardia, and it all started about 3-4 months ago. It was early December, and I remember driving home. I was super tired and I was exhausted, and I thought I was going to fall asleep while driving. But luckily I was 10 minutes away from my house. So I finally made it home. I ate something real quick and I decided to try to take a nap. Right before I was starting to fall asleep, I just started feeling like palpitation. And usually it does happen very randomly. And I really didn't think too much of it because it had happened before, but it was just like one-time thing and then it just went away. But this time it just kept on happening. Every like few seconds I could feel it, and I thought it was very odd. So I grabbed my stethoscope and I listened to my heart, and I realized that my heart was actually beating super fast, and like if I was running or doing some sort of workout, but I was trying to go to sleep. So I was listening to it and it was beating super fast, and then on top of that I could still hear the palpitation, kind of like if I had two different heartbeats, and it would go really fast and then it'll just slow down very slow, and it'll just go very fast and slow down very slow. So on top of that, like I said, I could hear the palpitations, but the palpitation was not continuous just like the heart. It was just like a few times and then it'll just go away a few seconds, and then a few times it'll go away. But my heart was still racing and it was still slowing down. I was very concerned, so I ended up going to the ER, and over there they did some testing. They did the EKG, they did the thyroid test, urinalysis, they wanted to see if I was pregnant. They also checked for like enzymes to see if I had just had a heart attack. They were able to see it with the blood test and like the regular CBC, the complete blood count, and things like that. You know, just like the basic things that they check at the ER. Everything was normal. I saw the doctor and the doctor just said, just follow up with the cardiologist. So I did. I went to see my cardiologist, and actually it was like a new person. It was an NP, a nurse practitioner. So I told her what happened, and she just ordered a stress test and the 24-hour Holter monitor. And I went to do the stress test and everything was normal. And then I wore the Holter for 2 days. So it was 48 hours. So I started wearing it at 8 in the morning, and then I had to go at 8 in the morning like 2 days later. And it was during Christmas time, so I started wearing it on Christmas Eve, so the 24th of December. And then I wore it all throughout Christmas Day. So Christmas Eve, I did not have any symptoms, just a shortness of breath and things like that, but I didn't feel any actual like palpitations. So the 25th at 7 o'clock, I was still laying in bed. I was not sleeping, I was just laying in bed, and I could actually feel a very noticeable palpitation. I wrote it down because they do give you a little piece of paper to where you write your symptoms, the time, date, and I guess what you were doing, like what activity you were doing when it happened. So I wrote it down, and then it was time for me to turn it in. I gave them the Holter, I gave them the piece of paper, and a month later I saw a EP doctor, which is an electrophysiologist. It's a cardiologist, but they specialize in things like that. So I was able to see him, but it was a month later. He's not at the office very often. So I'm not sure if that goes with all of the other EPs out there. I just know that at my doctor's office, that's how it worked. So I had to wait a month to see him. But I finally got to see him, and I saw the results online that it says PSVT. And when he saw me, he actually told me I don't have that. I have just ventricular tachycardia, which is apparently a little bit worse. I'm not too sure. But he told me that, and I was ready to ask him questions about what I had previously researched, which is the PSVT. So because this was something new, I didn't really have questions for him. I was just like a little bit confused. But he told me that he's not really sure where it's coming from or what's causing it. He asked me a few questions about my medical history and my family history. And that was it. He told me that since he's not too sure, he wanted me to do an MRI, and which I did. And they wanted to see, I guess, cardiomyopathy. I'm not too sure how to say it. And also they wanted to know if there was some scarring like in my heart because of, I guess, if I had previously had a heart attack or something like that, which I did not. Everything was normal for the MRI. And so basically we're just trying to do process of elimination to see what's causing the ventricular tachycardia. The NP said I was young, I should not be having that. And I honestly really don't know. We're still doing tests. So basically, once he said that that's what I had, he made like a follow appointment and then the MRI. But when it was time for me to do the MRI, like 2 days prior, I was actually at the hospital for the weekend. Well, twice. So I had an episode and I went to the hospital. I went to the ER. They wanted to admit me at the hospital, but since it was the weekend, they said that they didn't have like an EP on staff that day. So I did not stay over. They told me I was kind of stable to just go home if something happened, just come back, which it happened. So I had to go back to the ER. So basically I had to it was about midnight and I just felt like I was going to faint, like out of nowhere, just sudden dizziness. But it wasn't like vertigo, like the room spinning. It was just like I just felt dizzy and kind of like very lightheaded, and I thought I was going to faint. And my heart was racing. I had calmed down a little bit after that, like a few minutes after, but I started like shivering, like if I was very, very cold. And I couldn't stop myself. I'm not sure why that happened, but so yeah, so that happened, and I called the ambulance and they checked my blood pressure and it was like 171 over something, like I think it was 171 over 98. And I had calmed down by then, so I can only imagine how high it was when it all started. So they had prescribed a medication, flecainide, and I didn't take it because I read really bad things about it. So it's to control your heartbeat and I guess calm me down. But honestly, like, I was just so scared to take it. I didn't take it that day. So the next day, basically had the same thing, and my blood pressure went up. Again, it was about 170 over 100 or so. But this time I was like shivering and I couldn't stop. I was like that for about like 30 minutes. My blood pressure just randomly dropped from like 170 to like 70 over 59 or something like that. And that's when I was about to faint. The EMT had arrived by then. So they had me hooked up to the EKG and they said, well, you kind of need to be seen at the hospital. So they took me to the hospital and my blood pressure was down pretty much the whole time. But I did take it like when I had that episode while they were here. Well, actually like right before they came in, I had taken my medicine, the flecainide. Flecainide. I took that one right before they arrived and I feel like that kind of made it worse. I felt really sick, very nauseous, and I felt like I was gonna vomit. Sorry, but I felt like I was going to throw up, and I felt very dizzy and just very out of it. And it kind of went away. I took it like at midnight, and around 7 a.m. I started feeling a little bit better. But it was kind of bad. So I didn't want to take it again, but I did one more time because I had another episode. So I took it to control my heartbeat because my blood pressure was very low. I'm sorry, not very low, it was actually very high. So I took it to control my blood pressure, and it got me, I'm pretty sure it was the medication, because I was so dizzy and I felt like I couldn't even move. Like I felt like I was just drugged up. Like if I was just like very, very tired, I couldn't even keep my eyes open. I was trying to eat, I couldn't open my mouth. I was exhausted. And so when I went to the hospital, they said possibly the medication is just making it worse. So I stopped taking that medication, and they gave me metoprolol, which is for high blood pressure, and they told me that that would actually help the heartbeats also. So I was like, great, I'm gonna give it a try. So I did, and it does get my blood pressure down. Well, not down, but it kind of like controls it, like just brings it back to normal. And I take only a little bit, so I take like half of the pill, because my blood pressure usually does run 100, like 105 or so. So that's how I take it. I just take a little bit, but of course just take whatever. If you're taking medication, just follow what the doctor is telling you. So based on the test, that everything was normal besides the Holter that did say that I have ventricular tachycardia. They're trying to find out like what is causing it, but it's just like hard because they did pretty much all the tests that, well, according to the doctor, that they could do. I had an echocardiogram done about a year ago to see if my muscle was, I guess, weakening. But that was because of something else. I am gonna make a video about that. But that was normal, so they didn't want to do another echo. So basically they just told me to take that medication to control my blood pressure, because it does go up out of nowhere and then it just like drops. Obviously, it's not a normal thing, and that had never happened to me. So they wanted me to take the medication, and I'm not sure. I really don't want to be on medication for the rest of my life. I'm still young for that. So I kept having like little episodes of that, but it wasn't that extreme like that one time that I had to go to the ER. So the doctor said, well, because you are having that more often now and it's going to become more dangerous for you, we can talk about doing the cardio ablation. And honestly, if that is going to help, I might do that. So basically I have an appointment coming up with the EP, and we're gonna talk about the procedure. And he said that based on the fact that he's not sure where it's coming from, he honestly thinks that it might be 70 to 85% successful with the whole ablation thing. And I am still debating if I should get it or not. I'm leaning more towards doing it because obviously this is not quality of life. I can barely clean around the house because I get super exhausted. My blood pressure goes up, and then sometimes it just goes down. I'm not really sure, but it seems like walking around and I guess exercising makes it worse. I did ask if it was maybe anxiety, but he said that actually is physical. It's not anxiety causing my tachycardia. It is a physical thing due to the electrical impulse or something like that. So yeah, I'm still waiting to see what the doctor is going to tell me next, and I just wanted to share, I guess, like the steps of tests that they have done, my symptoms, like why I went to the ER. I actually do feel shortness of breath when I have like those episodes where my heart is racing like really fast. Obviously I get dizzy and I feel like I'm gonna faint, but I never actually do faint. So, which is, I guess, a good thing. But I just wanted to share it with you guys, and maybe somebody else is going through the same thing. I do look up online, I guess, like videos about people, like patients, but I never see anyone with just ventricular tachycardia. They always have like something else, which most likely I do have something else, but I'm not sure yet. But yeah, I just wanted to share this with you, and if you have any questions, just let me know, and I hope you guys have a good day. Bye-bye.